Medical professionals, what is the stupidest misconception a patient has had about the human body? I had a father of a baby absolutely beside himself because his newborn baby had no teeth. My mother, a doctor, volunteered to give a health lecture to high school girls in the South, Arkansas to be precise. During the QA period, when she asked if anyone had questions, a girl asked her if it was true that lemon juice was a good contraceptive option. She didn't understand, so the girl explained that after her boyfriend came inside of her, she would squeeze lemon juice into her vagina to prevent pregnancy from occurring. I wasn't there but can only imagine the look on my mother's face based on the way she reacted to my idiocy throughout my childhood. What do you mean, I can't eat an entire fruitcake? Isn't fruit supposed to be healthy? /diabetic type 2 with a blood sugar level of 450 mg/dl. Did you have anything this morning for your fasting blood draw? No, just tea with honey, and a glass of orange juice. They seem to think that, by pausing a seizure to inform us that they're having a seizure, they'll get benzos. Lol no. I still remember reading a Reddit comment from a doctor years ago that they were telling the person they were about to lose a finger. They said the person seemed way too okay with it, so the doctor asked how they were handling it so well, and the person genuinely told them that it won't be too bad because at least fingers grow back. It began a whole slew of comments from other doctors with patients who had the same misconceptions about limb amputations. How are you feeling today? Not great. I have a cough that starts from an emotion in my throat and chest. That emotion disturbs me, a bacterial pneumonia. Roommate is a neighborhood spiritual guru. I once administered a certain type of breathing test to a 58-year-old female patient who worked at a manufacturing plant on 8-hour shifts. In self-reporting her smoking history, she told me she smoked up to 8 packs of cigarettes a day. I think her misconception was that she was going to live forever. There was this really sheltered guy I knew who used to ask, which would you rather have, balls that were the size of baseballs or softballs? And we thought it was some weird hypothetical. Turned out no, he had one the size of each. Obviously, dude had some serious medical issues going on. But when we found out, I can only imagine the conversation that guy ended up having with the doctor. Can you email me my medications? Sure. I can send them electronically to any pharmacy you want. No. Skip the pharmacy. Ain't there some fancy schmancy way now you can send an email of some kind, and I just print it out and eat it, or I scan it with my phone and listen to it with headphones or some or other? I'm afraid not, sir. I had breast reduction surgery. My husband went to the pre-op appointment with me. The doctor was explaining the surgery and mentioned they would remove my nipples. My husband asked where they were going to get new ones from. 12 years later, and we joke about wondering where the nipple locker is. My mother asked me once, completely serious, why brain transplants were not possible. She didn't understand why if you had an inoperable brain tumor they couldn't just pop a new one in there like it was a heart or liver. I tried to explain to her that it wouldn't be the same person, but she just stared at me blankly. I love my mother, but oof, that was probably one of the stupidest conversations I've ever had. I'm training to be a midwife, and once met an expectant father who panicked when he heard that his daughter was breech because he thought this meant that she was going to come out of his wife's arse. Actually took a chunk out of the inside of my cheek trying not to laugh. I was getting dressed for a hunt with my EMT friend and he goes, "Dude, you've got a hernia." I was like, "Nah, I'm just growing an outie." He then proceeded to tell me how dumb I am. A few months later I had hernia surgery. SMH. My pre-med college roommate thought penises retracted inside the abdomen. My favorite teenage patient was asking about birth control and thought you could just wear the NuvaRing on your wrist instead of having to insert it in your vagina. Thankfully we got her on something else. Not a medical professional but a biology teacher. Anyone who has seen a picture of the pituitary gland may understand why I had a student who thought the testicles were in the brain. There are a few times a year where a teacher may have to try and hide their incredulous astonishment at student misconceptions, and I'm ashamed to say I didn't manage it that time. I ate a brick of Velveeta cheese this morning and am having abdominal pain. If I massage my prostate using my wife's dildo it makes it easier for me to pee. Not the dumbest, but most recent. I had a patient who needed a tooth extracted. Young teenage girl, obviously very sheltered. She was telling me how bad it hurts and I asked her what she takes for pain. I apply a little clove oil to it when it keeps me up at night. I asked if that works and she goes not really. When I told patient and mom to control post-operative pain with ibuprofen and acetaminophen, they looked at me like I had grown a second head. I'm a veterinarian and I can't tell you how many nipples I have diagnosed. Smiley face. P.S. Sorry that's not humane body but thought it was fun to share. Working in an ER as a nurse practitioner. I had a patient's granddaughter, who was pregnant, Asked me if she dyed her hair would it also dye her baby's hair. Made my day. Not a medical professional, but I was at the hospital after an injury and another patient who just had his left leg amputated. Asked the doctor how long it would take for it to grow back. I thought he was joking and chuckled. He shot an angry look at me and I realized he was serious. I asked an elderly patient to show me how she gives her insulin. She said, "I need an orange." I said, "Why?" She said, "Well, I draw up my insulin in the syringe, inject it in the orange and eat it." That's how the doctor showed me to do insulin. Grimacing face. Grimacing face. Not my patients, but from a nurse I knew back in the days. A man and a woman with some kind of developmental issues were trying to have a baby but intercourses wasn't working, so they consulted. Turned out the man was trying to insert his pee into the woman's belly button instead of her vagina. Apparently, the woman's belly button was full of bruises. I'm a dentist and the thing we get all the time that I hate is parents not caring about their child's decay because they're just baby teeth. Losing baby teeth early causes all sorts of problems aside from the pain and trauma, but in addition to that I often have to explain to parents that the adult teeth that erupt at age 6 are meant to last forever. They're always oblivious. Shoulder rehab after surgery on recurrent instability. Range of motion was not improving, so I ask if the patient is in pain. "Oh no, but I can't move my arm past 90 degrees because I feel the screws the surgeon put in and I don't want to break them by forcing the movement." It was the acromion bone. After a visual explanation, flexion magically went up to 120 degrees. Maybe the surgeon could have explained the procedure better, but sometimes I spend entire sessions repeating the same thing only to have patients ask me the same question over and over again. Health-related beliefs and fears hold tight in our brains. I had to explain to a couple 45 plus that treating the wife's yeast infection only but continuing to have sex without treating the husband would result in them both having a yeast infection. A young, talking maybe 17 years old, that feeding their neonate powdered milk was not the same as formula and that they were starving the baby. So many. So many. Long time ago, when I was a nursing student doing my LD clinicals, I had a young girl who was pregnant admitted for early delivery. She was 5 centimeters dilated and having routine contractions. She told us it was too early for the baby and wanted to know when she could discharge to home. If anyone cares, she stayed in the hospital and had a baby that day. Overheard in a clinical, so not mine specifically, but that vaginas are extra pockets. And that was safe to carry whatever you could fit in there around. I'm sure that provider had a fun conversation. I really wish I could have heard the rest of that. Reminds me of Patrick Stewart's confession that he didn't know he was uncircumcised till he was in his 60s. I had a colleague in her 30s with children who had come to the UK after marriage. She asked me one day if you could use tampons before you were married. She honestly had no clue about her own anatomy. I wouldn't call it stupid because it comes from a deeply caring place, but many people think that a palliative person who's not eating needs a feeding tube so they do not starve to death. Edit: this post solely refers to the elderly that are in long-term care. I used to take retinal photos to look for diabetic retinopathy. When I would call to make appointments, more than once a patient said, "Well, I just saw the proctologist." No sir, these are retinal photos, not rectal photos. My dad doesn't have a clue on anything that happens in the body. I told him I work in a tissue lab and he asked, "Oh, are you developing new Kleenex?" When I told him that I work with body tissue, this man really said, "Oh, I don't think I have that, I just use Kleenex." When I worked pediatrics, I had a 16-year-old kid pull his penis out and ask me if it was the right size. He said he'd heard about something called a micropenis and wanted to make sure his was the right size. He was almost tearful, telling me he had no one to ask and didn't want to Google it. I reassured him, but I'm still slightly suspicious it was a kink. I work at a pathology lab that takes COVID tests. We occasionally get phone calls like, "Where's the nearest testing site?" or "What's the wait time at?" Testing site name. All reasonable. Except for, does it hurt when the swab touches your brain? I'm guessing she had a friend or family member get a test and described it to her, but it was pretty hard not to laugh. I did explain to her what actually happens, and she seemed relieved, but it still makes me giggle to remember. I'm in the mental health field, but I met with a client who was worried that if their relative had a heart transplant, would the relative still love and remember them? The logic being that the feeling of love lives in the heart. I'm not a doctor, but my sister works in a hospital. No, you don't need to go to the ER for a paper cut. You won't bleed out. I don't always take my blood pressure meds, only when it's high. Rolling eyes face. I'm an X-ray tech working in a mammography clinic. Had a young woman come up to the desk and ask if she could ride home in the same car with her mom who just had a mammogram and might still be radioactive. Smiley face. A couple was pregnant and didn't understand why since they were taking the birth control pill. It turns out it was the guy who was taking it. Holistic doctors have convinced a lot of people that adding bleach to their drinking water will cure chronic diseases. Literally a high enough dosage to stain clothing being drank through a straw. Best part is there's no convincing them otherwise. My favorite was a patient calling my department 3 times with concerns about having to abstain from taking her blood pressure medication prior to an exercise treadmill stress test. She's afraid one missed dose of her metoprolol would give her a heart attack. She is very concerned because her blood pressure is so high these days. So I asked her if she's taking all her prescribed doses. She said she's supposed to take it twice a day, but often she only takes it in the morning and only half of what her doctor ordered. So effectively this lady was taking 1/4 of her BP med and couldn't figure out why her pressure isn't under control. Man shrugging. In my EMT class, the instructor asked us why women are more likely to have UTIs. One of my female classmates offered up dirty fingers as her answer.